Setting goals. To ensure the success of a psychological treatment, establishing concrete treatment goals is essential. Good treatment goals act as a compass, providing both the therapist and the client with a clear direction to work towards. Research indicates that psychological treatments with well-defined goals have a greater chance of success and lead to quicker results compared to treatments without specific goals. Additionally, setting goals gives the client a say in the direction of the treatment, as opposed to the therapist determining it all by himself. With this video, I'll guide you in setting concrete treatment goals to maximize the benefits of your psychological treatment. I'll ask you 2 questions. I encourage you to answer them and write down the responses to bring to your session. So, grab a pen and a paper as we move forward with the upcoming questions. Now, the first step in establishing concrete goals is addressing your request for help. Consider the following question. What would you like to achieve in this treatment that would make it worthwhile for you to start it in the first place? Pause the video, take a moment to think about it and write down your answer before continuing. Alright, we now have your request for help. Our next step is to set treatment goals. We'll formulate these goals based on the second question, which I'll present shortly. But before we proceed, a brief explanation. Because the most crucial but challenging aspect of setting treatment goals is that they are only useful when extremely concrete and specific. Therefore, it's essential to formulate them in terms of concrete behavior, things that you can choose to do. Now, this might leave you a little puzzled because the reason you've looked for help of a psychologist is most likely that you want to change how you feel, not necessarily how you behave. However, an important rule should not be forgotten, and that is that behavioral change always comes before emotional change. There's no direct way to change your feelings. The only way to influence them is by developing new behaviors that enable you to feel differently. In addition to expressing your goals in terms of behavior, it's crucial to make them very specific. So don't just write down what you want to do differently, but also how often, in which situations, and in what manner. Furthermore, it's important to write down goals that are challenging but achievable. They should be actions you're not currently undertaking to avoid making them too easy, and at the same time they shouldn't be overly difficult. Achievable goals are the most motivating ones to pursue. So now that you have this in mind, let's try to formulate these behavioral goals. We'll do this using the next question I'm about to ask. Imagine that in a number of sessions we managed to address your request for help as you've just written it down. We've achieved what you said you wanted to, such as feeling better, increased self-confidence, or reduced anxiety in your day-to-day life. Now the question is, what will you be doing differently from what you're doing now that indicates we've achieved just that? What specific actions would you do differently that would indicate our success? For example, you might consider, if I'd feel better, I'd be able to go to the gym twice a week. Or I'd be able to strike up a conversation with a stranger on my kid's school playground. Or when I feel sad, I'd be able to endure that feeling for at least 20 minutes without seeking distraction on my phone. So here's the question again. Pause the video once more, take the time to reflect on this question and write down your answers. Discuss the goals you've written down with your therapist, with whom you'll review them. He or she may suggest adjustments if your goals can be made even more specific. Don't feel discouraged if it feels a little challenging. It takes time and effort to come up with useful goals. But with these goals, your treatment will have the biggest chance of leading to sustainable change. I wish you success in your treatment.